Hi everyone, my name is Tyan. I'm a respirologist working in Saskatchewan. Thank you for this opportunity to share with you some of my experience in learning quality improvement. I started this project with a few specific personal goals. I have a very specific interest in looking after patients with lung cancer, and being fairly new to this province, I quickly realized a good portion of the patients are traveling long distance to centers such as Saskatchewan, Regina for more specialized care, and patients with lung cancer are certainly no exception with their complex diagnostic workup. So I wanted to reduce the travel time. I want to reduce the duration at which these patients spend in staging and diagnosis. And secondarily, I want to know that I'm making meaningful improvements. So I want to know the scientific methodology and quality improvement. And it's not until I started learning QI that I started realizing there's a lot more tools that I needed to use that I didn't even know I needed to start when I started it. The way I'm thinking about QI is as much of a science as it is an art. It's about working with people, creating a community, sharing ideas, and taking an idea from an action to taking the idea to an action and testing it. And we certainly learn a lot about that in this course. Secondarily, in the more technical aspect, I had an idea of changing, but I didn't know how to approach it. So when we were taught how to construct a value stream map, it gives me a better idea how the bigger picture. Once we were able to identify how things flow, we can target on specific drivers for change through talking to other partners. And lastly, I needed statistic tools to be able to know that the changes I'm making are significant, and that's where you learn about run chart and control chart. Switching gears to the experiential aspect of things, initially, I perceived this huge challenge to get support from different groups, as I needed to get support from like the radiology department, pulmonary function, the surgeon. And I think that's part of because who I am, I'm not used to asking for help. But when I reframe my mind in terms of who I'm asking the help for, it's for the patient. Why I'm asking for help for is really to improve their quality of care. It really made it easy. And it was surprisingly easy to get support from all my colleagues. When it comes down to actually doing the project, we start to identify there are many drivers, and I quickly realized that we need to scale the project to focus on a specific area to make the changes from there. So we focused on coordination in rural Saskatchewan patients in particular. And as the project started to get going, there are occasional communications or emails about frustration in the way things are implemented. As I explore these reasons, oftentimes gaps in communication. And lastly, as we start to collect some data, we start to see some shift, but there's always some outliers. Initially very frustrating in their eyesores. You're like, well, what's wrong? But in fact, they're very, very valuable for me to go back and look at the data and see why are these patients not following the trend that I think it is. Lastly, looking ahead, I think the past 10 months has been very valuable in helping me to have a set of tools to carry out further quality improvement projects. And we talked a lot about PDSA. I think for me, it's listening to the patient, listening to your colleague, be able to understand how the system works, organize a group of people, be able to test your theory, troubleshoot it, reevaluate. In the upcoming next few months, I would like to learn more about how to implement changes in a way that's very user-friendly. I would like to also address further barriers that require a little bit more, such as like resource and space. And lastly, I think all of us want to be part of the change to move the culture of quality improvement in our work. And with that, I want to acknowledge all these fine people and the institution for supporting me. Thank you.